Time for some education. Ask the expert. Today we've got Dr. James Essell, the return of Dr. James Essell, my cancer doctor's OHC. He's a hematologist, medical oncologist, blood and bone marrow transplant specialist, and cellular therapy expert. One of the fine physicians you'll find at OHC, which you can find online at ohcare.com or call 888-649-4800. Dr. Essell, great to have you in studio today.
Good morning, Brian.
There's a month for everything, and this March is Multiple Myeloma Awareness Month. So start by talking about what is multiple myeloma and what are the risk factors for it.
So multiple myeloma is a hematologic malignancy, basically plasma cells that make antibodies, that when vaccines, infections, so forth, those plasma cells can go wild and cause a cancer. The symptoms of it, these plasma cells can get in and dissolve the bone. They don't cause pain, but it can cause fractures. That can cause the calcium to go high. It can be detected with a routine visit to a doctor. You don't have to be looking specifically for myeloma. Seeing the calcium and the protein and subtle hints can help out.
Wow.
Catching it early.
Now, it obviously, this is a cancer. Can it spread, metastasize, that kind of thing?
This typically can affect the bone marrow, so your blood counts can be low, but it can go to the bones, cause broken bones. It can cause kidney failure. So catching it early is really important because it's very, very treatable if it's caught early.
Well, that's good to hear. So what should people be looking for, the signs and symptoms, to make sure that they can get ahead of this?
Really fatigue. There's bone pain possibly, but it's really get a routine test with your doctor.
That's it?
Yeah, that's the main thing.
You just ask for it?
Well, no, if you go in, the test that they get where they get your chemistries.
It's standard blood panel?
CBC, CMP, it can be picked up.
Oh, well, that's convenient.
Yeah.
Because, hell, we all get those. I get like 4 of them a year.
Exactly.
Anymore. Yeah,
exactly.
Good. Well, I'm under your guys' care. So, we always talk about treatments. You sound like there seemed to be a sense of, a note of optimism in your voice that, you get ahead of this and there are treatments for it. What do they involve? What do they include?
So, I saw a patient a few months ago who told me, when I first saw you, told me this about 5 years to live. And she's at 15 years now. So things have really changed. And not continuous, terrible chemotherapy the whole time. The new treatments, like we've talked about, Brian, in the past, are the immune treatments. CAR T now for myeloma is now approved in the second line, so first relapse. And we're looking at the using the immune system to find a target. In this case, it's called BCMA, B-cell maturation antigen. And we have CAR T, we have what's called BiTE therapy against that. But when that quits working, what do you do next? Well, now there's a new target called GPRC5D, which long term. But when we use a bispecific, in other words, use an antibody that pulls T cells to that cancer over a long period of time, it causes a lot of horrible side effects. Bad taste in your mouth, skin problems, nail problems. It's kind of nasty, and people may be in remission have to quit it because of the side effects.
Oh, wow.
We're pioneering a CAR T, and the first patient's coming up, I believe, this week, where instead of having this long exposure and getting those side effects, they get all the cells at one time with the infusion of chimeric antigen receptor T cells made from the patient's own blood, put back in. So they're only exposed to that for about a month, go into a deep, long-lasting remission without the side effects. And that's after they've already been through CAR T. So, people that have this, we don't have a cure right now, but they can live for a very long time.
Well, that's very good news. Now, these are bespoke treatments, correct? This isn't something you get off the shelf?
No.
Okay. So how long does the treatment protocol go then? And how long does it take to build these cancer treatments, these bespoke treatments?
The typical person gets kind of a oral combination of a monoclonal antibody like you're getting with an oral for about 4 months to go into remission. Then they'll get an autologous stem cell transplant, high-dose chemotherapy, which is fairly toxic.
Yes.
And then after that, they're on a maintenance pill, and that usually goes for about 5 years. At that point, then CAR T would be involved, and then after that's going to buy you another couple of years. Then after that fails, maybe bispecific therapy for another couple of years, and we can just keep adding these on at this point.
Wow. So it's very long term.
Yeah.
It's cancer. So.
It's long term, and because of that reason, side effects are critically important. So we're always looking at doing a better job from an efficacy standpoint, but also make it tolerable.
I have to ask you this because you and I exchanged a couple of words about RFK, bringing health to our attention and making an effort to get better foods, better diets, get rid of the chemicals, the additives for all of our collective health benefit. How important in cancer, generally speaking, is diet?
I don't think anybody knows, but if you look at when we were kids, first of all, nobody went out to eat. You couldn't afford to, and there weren't all the restaurants. The food was sourced locally. You went to the local butcher shop. Now you go to the supermarket, and the beef's from all over the place. So there's been a change, and clearly we see younger people getting cancer earlier. How much of it's diet? How much of it's some other environmental? But I think diet clearly is part of it.
Well, okay. I kind of felt that way as well because the abundance of sugars in our diets, and I've been reading so much about sugar and its impact on our health, and having cut the sugar out, I always just use this opportunity just to tell people, give it a try because you'll feel a hell of a lot better.
Plus, treats your diabetes and your hypertension and cardiac disease and all those things.
Well, fortunately, I didn't have any of that
well,
stuff.
But it keeps you from getting it.
Yeah. So in terms of clinical trials, I think you might have just gone over it already, but I know you're always doing clinical trials at OHC. And, folks, if you got cancer, get a second opinion if you're already being treated by someone, or make sure you're on the cutting edge with these clinical trials because that's where it's all happening. So those would be the CAR T and BITE therapies you talked about already?
And we also have some for maintenance therapy that, if you're happy with where we are in cancer therapy, don't go on a clinical trial. But nobody's happy. You want to do better. You want to have less toxicity, live longer. And people think, I don't want a placebo. There's no placebo in these. You get standard of care versus something we believe will be better. And you're followed closer than you would be off of a clinical trial. So if there is a side effect, it's caught early and we close the trial. But a strong believer, that's how we make progress.
Well, and that's how you've gotten to this point.
Exactly.
I mean, CAR T went through some clinical trials on that, and that's the information you've given me over the years, and the other OHC doctors have on that. I just find it truly amazing. I mean, you have eliminated some very difficult cancers just with this CAR T therapy.
Correct. Right. I mean, it's using your body, using your own immune system, getting away from chemotherapy. That's where everything's going.
Yeah, and there are some significant downsides of chemotherapy. I know that.
Yeah.
All right, doctor. Any other words on multiple myeloma?
Just a couple things. This is usually a disease, kind of in upper 60s when it starts, but we do see younger people. There's increase in your African American listeners. They should definitely be thinking about being checked. As far as environmental, for the veterans that listen to your show, this is an Agent Orange related cancer.
Oh, really?
So all the Vietnam vets, should be thinking about this too.
Well, I'd like to hope, since they get VA medical care, that they are getting that blood panel that we talked about, so they will know ahead or early on in the game if their numbers reflect that it might be a possibility.
Right.
Dr. James Essell, it has been a great conversation. I always appreciate the work that you're doing at OHC, and I feel that I am in great hands getting my treatment there. To reach OHC, again, online, ohcare.com, ohcare.com. The number to call, 888-649-4800. That's 888-649-4800. Dr. Essell, keep up the great work, sir.
Thank you.
Thanks for all the work you're doing for my listeners as well. Folks,